Hi, I'm Sara Waters, and I'm a physical therapy major here at Quinnipiac. Tonight, I'm going to be discussing healthcare on a global scale and how it affects individuals in our global community. Article 29 of the Universal Declaration of Human Rights states that all individuals have the right to medical care, no matter their financial status, economic status, or social status. But this is not the case on the global scale. Individuals receive health care based on their financial status. If their country provides them with free public health care, then citizens will get health care that way. But if this is not the case and individuals don't have the financial means to pay for their own health care, then individuals will not receive health care and will not save life-saving treatments that they need. Currently, there's 58 countries that provide universal health care to their citizens. Universal health care means that citizens receive a full spectrum of health care without the financial burden falling on themselves, because the financial burden falls on the government. Currently, South Africa is working on a plan to implement universal health care. Apartheid has had lasting effects on South Africa's community, especially on their health care programs. During apartheid, there was no free public health care that was offered to citizens, and only very expensive health care. That meant that the whites were able to pay for their health care, while blacks, colors, and Indians were not able to get health care. And this has created a society with people who are still having lasting effects of non-health care, and also there's not enough healthcare programs or hospitals or clinics in all parts of South Africa. Currently in South Africa, 16% uses the private healthcare sector, and it receives 48% of the South African healthcare national budget. And the public healthcare sector provides healthcare for 64% of the South African population, and it receives 49% of the healthcare budget of South Africa. So that means that the public sector helps about 5 times the amount of people, but only receives 1% of the budget. So this means they do not have enough amount of money to provide the care they need to citizens. In 2011, South Africa spent about 8.3% of their gross domestic product on healthcare, while the World Health Organization states that you should spend about 5% of your gross domestic product on healthcare. Even though South Africa spends more percent of their budget on their healthcare systems, their healthcare is still compared as inadequate to other countries. This is because of South Africa's doesn't use their resources correctly, and also because there's a large gap in care provided to the rich and to the poor because of the lasting effect of apartheid in South Africa. But currently, South Africa is working to improve these problems, and they're implementing a plan called the National Health Insurance Plan. In March 2012, the National Health Insurance Green Paper was released, and this is a 14-year program that's going to slowly implement health care across South Africa to limit the gap between the rich and the poor and allow all citizens in South Africa to have equal access to health care. The first part of this plan started in April 2012, where 11 out of the 54 districts in South Africa were given health care, and in this next year, the white paper is going to be released, which is going to detail how these pilot programs worked and their future plans for the health care in South Africa. I think that all countries around the world should start supplying universal health care to their citizens, and while this is an expensive endeavor, I think governments need to think about how, not the cost of health care, but how health care affects their communities. Health care has a positive impact on an individual, therefore they can only have a positive impact on the social, economic, and political parts of that country. Thank you for listening.
You mentioned in your presentation that South Africa uses more of their GDP percentage-wise.
Yeah.
But they're not using their funds properly.
Yes.
Do you find what they're using their funds on?
Well, I think it's because how they allocate their funds. It's almost like equal between the private and the public sector, but the public sector helps more people. So it's not like if they help more people, you think there should be more percentage of their funds there. So that means a bunch of people in South Africa are not receiving the care they need because there's not enough financial resources.
Thank you.